Hello, my name is Joseph Wager.
And my name is Allan Ridings.
We work for the Cooperative of American Physicians Risk Management and Patient Safety Department.
And today's risky tip is regarding scanning of electronic medical records.
So with the introduction of electronic medical record, physicians are scanning a lot of data into their system. One of the questions that we get is how much data should be scanned into my system? Traditionally, we say you only scan the information that is necessary to provide patient care. As a physician, you make those decisions and scan this information into the system. The vendor may be able to do it for you at a cost. However, scanning can also be accomplished by your staff. There's also a cost associated with that. Just remember that scanning must be completed for you to provide patient care.
And as Joe just indicated, it is costly to have a vendor do this. However, train your staff to do it correctly up front. That way, any future paper medical records that come in can be scanned into your system, indexed, and sent straight to your inbox on your electronic medical record. So what actually happens when you come back to your office after seeing patients or after lunch and you find paper telephone messages on your chart? This is still part of the scanning system. What actually has to happen is you'll contact the patient by telephone, you'll give them some advice, but you're going to have to type that information into your computer system. After you've typed that information in, the original paper record needs to be scanned into the electronic system to show that you have part 1 and part 2. The paper came in, and here is the result on that paper.
As Allan mentioned earlier, scanning is important even with messages. The messages need to be scanned into the right appropriate chart, and then obviously make sure that the staff knows what they're doing. Make sure there's a patient ID associated with any quote-unquote message. The message is always part of the medical record if you scan it or if you electronically put it into the system. Hospital records are part of the medical record for your office. Traditionally, the office will get a copy of the medical record from the hospital indicating the history and physical and discharge data. To complete your medical record, that data needs to go into your computer system. To basically get that accomplished, you need to scan the information into the system. That information needs to be indexed appropriately and be part of the medical record for further patient care.
So as Joe just indicated, what you need to do is when that paper record comes in, make sure the patient's ID is on it for your office system, scan it into the system, verify that it's been accepted, and have your staff members index it to the correct section of your electronic medical record. Once that has been done, either shred the information or hand the original paperwork back to the patient that brought it in. So what's actually different about scanning patient information in your home office versus scanning into your medical office? Well, essentially, the system is the same. However, you need to make sure that you have PHI and HIPAA at the forefront of what you're doing. If you're connected by telephone line or if you're connected by a DSL, you need to make sure that the information you're scanning in is indexed to the patient's record and there's an ID number on it.
Scanning at home may be different. Traditionally, you don't put a patient ID number on your scanning information. If you're scanning information to your medical record from home, make sure there's a patient ID. That information is carried across every time you come into your system. However, doctors have a tendency of just scanning information and sending to the office staff to correct themselves. One of the concerns is always make sure that your scanning information has the appropriate ID when scanning into your system.
So to paraphrase, what you need to do is make sure that IDs are available if possible, and train your staff to grab that information, look for the patient's name, and index it into the patient's correct chart.
Scanning is important that pertinent patient data information is in your system.
This has been another episode of the CAP Physicians Risky Tips.